Hey everyone, welcome back for video number 3 in our brand new functional breathing mini course. If you missed the first 2 videos, you can check out the link in the video description for the entire playlist. This week we are continuing our conversation on the biomechanical dimension of breathing. I have a really special treat for you guys today. My very good friend and colleague Verity did a super thorough postural assessment and gait analysis on me, highlighting how my stance and my gait really impact my breathing. So I think this is going to be really interesting for you, and I hope that it gets you curious about how your stance and your gait and your movement patterns are impacting your breathing. If you're new to the channel, my name is Tara Bianca, and I am a long-time holistic health practitioner and functional breathing coach. I want to jump right in. So you're going to hear Verity in the background analyzing, and she's going to be drawing on the screen, and then I'll interject once in a while just to offer a little bit more clarity and to share with you guys how what she is observing in my posture and in my gait really matches up to what I feel in my body.
Let's look at standing first before we look at the gait. The left hip is definitely higher than the right. There is a leg length discrepancy. The right leg is shorter by 4 millimeters, which is usually managed fairly well by people, but that's something we need to hold in consideration when we're looking at managing her movement plan.
Right, so just to clarify here, I used to study with a group of therapists doing neurosomatic therapy, and their entire lens for viewing the body really comes out of the realization that an actual structural leg length discrepancy is way more common than you think in the general population. And so they have everyone get x-rayed in this very specific way in order to measure this true leg length difference. And so I do have my x-rays, and I really wanted to share them with you guys today, but unfortunately they are in a box in my mom's garage, and I just couldn't locate them in time to make this video. So I'm going off of memory here, but I'm pretty positive that my results showed that my right leg is about 4 millimeters shorter. So now, to be very clear, that is a very small amount. And as Verity is saying here, most people can manage that small amount without a huge amount of dysfunction or pain. But I have personally found it to be relevant in my life. So let's see how that plays out in Verity's assessment.
The spine is curving first to the right and then back round to the left to balance herself out, which is why there's a keener bend here.
Right, so that's that super obvious V-shaped bend that we saw in the left waist crease last week, right? I was pointing that out in the pictures from last week's video.
So these left ribs at the back here, the posterior ribs for breathing, are much tighter than the right.
Meaning it's really hard for me to breathe into that mid-thoracic spine, that posterior rib cage. And Verity is saying that she's really seeing that on the left side in particular.
The shoulder blades, the scapula, this bone here, look like they're winging, which means you can see the space behind the shoulder blade, between the shoulder blade and the ribs there. And it looks like more on the left than the right. Now, that can be a shadow issue because the light's coming from the left, so that needs to be tested.
It's not a shadow issue, right? It's definitely more winged on the left than on the right. We saw that in the picture from last week as well.
But that would indicate that her left ribs are rotated left, making that space. And you kind of see a bit of tension here, just like she's pulling herself around, which could indicate that her pelvis is slightly rotated right. All of these need to be tested more. But this would suggest that with the rib flare and that rotation element, there's a lot of compression and stuckness in the left back ribs.
Okay, I brought my friend the Pelvis to help with this demonstration. I was able to dig this out of my mom's garage. And let's take a few moments and just orient ourselves to this pelvis so that as I use it to help explain what Verity is saying, we kind of have a sense of what we're looking at. Okay, so here's the back of the pelvis, right? So this is like looking from behind me. This is where you would see your glutes. So we have our sacrum here, right? That triangular bone at the base of the spine. We have the coccyx hanging off the bottom. We have our 2 iliums, so our 2 ilia, our big hip bones. And if we turn it and look anteriorly at the anterior side, right here in the middle, we have our pubic symphysis. This is that joint that joins the 2 sides of the pelvis together. This is also where you have all your abdominal and oblique attachments. Here again, we have our 2 hip bones, and here these bony points sticking out the front. That's our classic landmark, our ASIS, our anterior superior iliac spine. We use that as a major landmark for muscles and for palpation. Below it, we have another little bony protrusion called the AIIS, the anterior inferior iliac spine. Then we see in the back here, we have the front of the sacrum, and we also have our L5 and L4 vertebrae here, along with the intervertebral discs. And then we also have our femurs attached to this little pelvis. So we have the femoral heads in the acetabulum. So this is called your coxofemoral or acetabular femoral joints. You have the neck of the femur. This is a common fracture point. And then this big lump off the side of the femur. For those of you who have ever experienced like trochanteric bursitis or something like that, this is the greater trochanter. So you can see it's such a huge bony protrusion. There's a ton of muscle attachment here, mostly the glutes and the deep lateral rotators. And then also, for those of you who are interested, this smaller protrusion off the back of the femur, that's your lesser trochanter. So that's where your psoas inserts. So now everyone's favorite muscle, the psoas, is so interesting because look, it starts back here posteriorly and then travels forward through the pelvis, up across the ilium and connects onto the lumbar spine. So that's just to give you a couple little landmarks. These here are your obturator foramina. So those of you who are doing a lot of pelvic floor work these days, you know that your obturator internus is a really popular muscle that also connects off this greater trochanter and connects into this obturator foramen space. And then of course, if we look from the feet upward towards the head into this huge opening here, right? This is where you would find all your pelvic floor muscles. So everyone always hears everyone talking about pelvic floor these days. So look at this gaping hole in the pelvis, right? This is where all the contents of your abdomen sit, right? So all your internal organs are pressing down into this space, and your pelvic floor is the only thing supporting all of that organ mass, all of that weight of the organs. There's no bony prominences or bony projections to keep the contents of your abdomen inside your abdomen. So you're very reliant on these strap muscles across the pelvic floor in order to maintain organ stability and to maintain the organs inside. And all of this pelvic floor musculature works in conjunction with your thoracic diaphragm to maintain intra-abdominal pressure and to kind of control force and pressure through the body. Okay, so let me orient the pelvis so that it matches what you're seeing on the screen when I am standing and walking. So Verity is saying right now that from the beginning she saw a little bit of a left hip hike. So meaning the left ilium is a little bit higher than the right ilium. And look at what happens when I lift my left ilium, what happens to my lumbar spine, to my L4, L5. As the left hip hikes, you get this side bend towards the right with the lumbar spine. And then she was saying that she sees that side bend starting to the right, but because my body wants to come back to midline, because my eyes always want to be on the horizon, I have to counteract that right side bend by then bending back to the left. So that's why we see that left curve kind of through the thoracic spine, bringing me back to midline. And so that's side bending, but then let's also talk about this rotation that she's seeing. So she's saying it looks like the left ilium is a little bit more rotated toward the right. And so if that left ilium is rotating towards the right, again, what has to happen with the lumbar spine? That has to continue the rotation to the right, but I can't infinitely keep rotating to the right, right? Because I'll be facing the right all day and I won't see what's happening in front of me. Again, my body has to self-correct. It has to bring me back to midline somewhere along the chain. And so what she's saying right now is that she's seeing that as I start to rotate right, eventually up the spine, the shoulder and the scapula start to try to pull me back towards the left, and it's creating more of this winged appearance on the left scapula.
So the left diaphragm is really struggling with full movement with the inhale because there's no space to expand there. It's too tight, but also with the full exhale, the left side isn't able to be stabilized by that diaphragm. So by improving these, we could really improve her efficiency. And so without that left diaphragm and the left expansion breath on the left side, that left half of the pelvis is more unstable. And you can see the difference in the tone between the two back of the hamstrings and lower glutes.
Okay, so she keeps saying that left diaphragm can't expand because of the way I'm standing and compressing into that left posterior rib space. But what exactly is she talking about? Don't we only have one diaphragm? Well, the work that Verity does really comes out of postural restoration, where they consider this huge expansive muscle, your diaphragm, almost like having two separate lobes, where the right and the left side can operate somewhat separately, and where one side can be a bit more dysfunctional than the other. And so if we look back to the picture from last week, we can really see that out flare, that external rotation of the rib cage on my left side, which is preventing the left side of the diaphragm from getting enough leverage to fully descend on the in-breath. And it's also causing this compression in the lower left thoracic spine, which we see in Verity's analysis here, which means it's also blocking expansion in that left posterior rib cage. And Verity is saying that that then leads to the left side of the pelvis being unstable. So she's seeing a bit of an instability down here in the pelvis due to what she is seeing with the left diaphragm a little bit further above. And so that's pretty revelatory, because this left SI joint, so this area where the hip bone itself connects to your sacrum, these two joints here, those are called your SI joints, your sacroiliac joints. So that left SI joint has really been the epicenter of my pain and dysfunction for most of my adult life. So back when I was about 25, that was the first time I really sheared this joint, so to speak, and it brought me to my knees. I was a personal trainer at the time, and we were training plyometrics, and I remember I was doing these really high box jumps, and this joint just was not ready for it at all. I almost blacked out from the pain of that initial injury. It was so intense. And then when I was about 34 or 35, so now you're looking at 10 years later, I had a major relapse with this same joint. And there was a period of about 14 months probably where I could barely walk. I was dragging my left leg around with me everywhere I was going. I was in constant nagging nerve pain. I couldn't get comfortable in any position. It was really hard to sleep. I couldn't exercise. My nervous system was completely fried. It was awful, and it all started with this spot right here. So it's really interesting that Verity is picking up on that.
You see the right calf muscle is a lot bigger than the left, which indicates that she moves herself forward in life mainly with her right side and her right pelvis.
And you can really see from the back how much more organized and aligned that right side looks. So you get the sense that I'm weight bearing a little bit more on that foot. It's definitely my dominant leg, so it makes sense that the musculature on the right side is more hypertonic. And again, 4 millimeters is a small discrepancy, but it would make sense that I would want to stand more on the shorter leg, right? So it could play some role here as well.
Side on, she's just slightly leaning forward of her gravity line, but generally you can see she's done a lot of work on herself and she's managing this position right here pretty well. So let's go and look at the gait.
Okay, let me pull up another gravity line so that you can see the difference here and have a comparison. So we'd like to see this alignment between the ear, the shoulder joint, the hip joint, the knee, and the ankle. And you can see that my alignment is pretty good, right? It's pretty stacked, it's pretty straight, but in this stance, it's like the whole thing is sort of shifted a little bit forward. And it's interesting for me to see this because when I'm walking, it's very clear to me that I have a little bit too much weight in my heels and that I'm kind of leading with my chest and with my hips instead of pushing myself forward off of my feet. So we're going to look at the gait now and let's see how that kind of plays out.
She's very fluid as a dancer, so there's a lot of movement, particularly in this area here. There's a lot of hiking and dropping of the pelvis, which is lovely, but can cause pain because there's a slight tendency to be unstable. Now, what's fascinating, what I said before, is that this possible right leg length discrepancy might be the root cause of it all, but that doesn't explain why when she strikes with her left foot, there's a rise, a quite large rise of her left pelvis, and an anterior tilt, and you can see that by this crease here in her skin.
Okay, so to clarify, she's saying that when I step onto my left foot, I have this sort of dramatic rise on the left side of the pelvis, and then look again at that compensation in the lumbar spine, how everything has to shift and side bend to the right, and that I go into more of an anterior pelvic tilt on that left side as well when I go to stand on the left leg. So let me just clarify for you what that means. Let's just look at what it means to go into an anterior or posterior pelvic tilt. So when these femurs are kind of stable and the two ilia drop forward as if you were going to drop the contents of your pelvis or drop the contents of your abdomen out of the pelvic bowl, when you go forward like this is considered an anterior pelvic tilt. And what this looks like is a booty sticking out kind of position. And then a posterior pelvic tilt would mean that the ilium are falling backwards, and we would call this like tucking the tail. So whenever you see someone really tucking their tailbone under, we call that a posterior pelvic tilt. So Verity is saying that when I stand on my left leg during my gait cycle, I'm getting more of a hip hike and also an anterior tip on my left ilium.
Her ribs are flaring, and so there's a lot of compression around this area of her body, exactly where she was standing before.
So again, this area that Verity has highlighted is definitely where I've experienced the bulk of my pain issues over the years. It's spot on again.
So when she's on her left leg, she goes into her standing pattern. Makes it very, very hard to breathe into the back of her diaphragm.
So when I step onto my left foot, Verity is saying that I go into that exact same pattern that we just saw in my standing posture, where I'm creating a ton of compression in the lower left posterior rib cage, and I'm not able to get my breath to fully descend and expand into the back of the body.
And if she's going on a long hike and she's repeatedly doing this, this is going to show up as quite a lot of tension around this area here, because the hamstrings and the adductor and the deep obturator alternus, gemellus twins, all the deep muscles through here are not helping stabilize her pelvis, and the sacroiliac does not like that shifting from side to side.
Right, so this is really spot on. I love to go for long walks, maybe 5 to 8 miles at a time, and I really like to hike for an hour or two. And whenever I finish my walk or my hike, and even sometimes during them, my low back is so exhausted and I feel so desperate to just get into some kind of really deep spinal flexion in order to try to counteract all that extension that is driving force into my low back with each step over and over again. In fact, for me, it feels amazing to walk backwards because I'm actually able to get my pelvis into more of a posterior pelvic tilt, or for me, something close to neutral. And when I can get the pelvis more into a neutral position, it sort of automatically kind of corrects these compensation patterns further up the spine, and it allows me to breathe a little bit more deeply and more easily.
Now, when she heel strikes on the right, there is a hip hike as well, but it's not as significant. So both sides, stability, I think, would really benefit. Can see if that really makes a difference to that pain. Now, going back to the weaker right leg, the left leg pushing off, when she pushes off her right, can you see how her left arm swings, this point here, there, swings back, but she's using a little bit of her back extension to do that. And when she pushes off her left, can you see that her right arm doesn't come back as much, and actually instead of goes back, moves outwards, is that she's not really using that left leg to push off. And you can see the tone here in that muscle is not activating as much as it is on the right. So we've done brief lateral sides. Let's look at rotation. Now, the left hip, subtle, but rotates there forward more than the right rotates forward. There, can you see that? Anterior tilt on the left and very much rotated to the right, which means her spine is also more rotated to the right, and then she's also trying to pull it back to center herself with the left side because of that of not being able to get her left hip back here. So she's always in a slight spinal rotation to the right. And so this is deep left adductor work, left hamstring, left calf work to help really stabilize through that area of her body.
Right, so she's saying that with each step of the left leg, again, that left hip is going into a little bit more of an anterior pelvic tilt, and it's also going into a little bit of a rotation to the right. And so we spoke about this earlier about how the compensation of the spine responds to the position of the pelvis. So as the ilium rotates to the right, that spine has to rotate to the right, the spine has to rotate to the right, but at some point, we have to come back towards midline. At some point, the spine has to find this counterbalance of rotating back towards the left. And Verity is seeing that happen sort of at the level of my scapulae, right? Of the inferior angle of the scaps. And again, the rotation happening at that level is contributing to this compression into the lower left rib cage that she's seeing that is blocking my breath from deepening and supporting me during my gait cycle.
View of her unaware and more of a relaxed stance. You can see more of the dancer's stance coming here with the long top of the hamstrings, the anterior tilt. She's managing her rib flare well, but that would increase a kind of slightly thoracic flattening.
Okay, I love how Verity politely calls it the dancer's stance. I mean, I guess it's very cute, this stance, but it's not the most functional, right? So she's pointing out that when I'm relaxed and not thinking about my posture so much, and maybe not thinking about being recorded, I go much more again into that anterior pelvic tilt of the pelvis where both ilia, are falling forward. And it looks like my booty's sticking out in the back, right? I love to stand that way. That's my natural stance. It's very comfortable for me, but it really cranks my low back. It's not optimal. And so she's saying that I'm stuck in this anterior pelvic tilt and that my hamstrings, which are also attached to the pelvis, right, at the ischium, at the ischial tuberosity, are not doing their job of pulling the pelvis more posteriorly, of pulling the pelvis into more of this neutral position. And that's because, like most dancers, I have a lot of hamstring extensibility. I'm very flexible in this area, but I'm not stabilizing well. So the body is always trying to find this perfect balance, right, between mobility and stability. And then she said, I'm managing my rib flare well. I almost cried when I heard her say this because it made me so happy to hear that the work I've been doing and putting into this is actually paying off a little bit. So I've managed to create a little bit more stabilization for myself. Normally with this anterior pelvic tilt, you also see this huge rib flare, right? And you see the person almost back bending all day, where their chest is really sticking up, their ribs are really sticking out, and their booty is really sticking out. And that is more classically how I used to stand years ago before I started to make corrections. But she's saying that I've gotten some control of it. So instead of being stuck in this full extension pattern, really compressing the low back, which I still am doing to some degree, the fact that I've been able to get my ribs down again feels like a huge accomplishment to me, and it really shows that you can make improvements over time.
When she pushes off her right, there's this moment here, she's in managing it quite well, and then there, that moment there, she falls into an instability pattern of dumping her pelvis forward and finding that rib flare, which then compresses, and that's as she goes onto her left leg, that lack of stability then compresses through the back of the left diaphragm. Very hard to breathe in that position, so then she has to rib flare to breathe.
Right, so this is that same thing again. As soon as I step on my left leg, that left pelvis dumps forward, and then the rib flares a little bit more on that left side because I'm not able to stabilize well on that leg. I'm not able to coordinate and balance as well on that side, and the lack of stability prevents me from being able to take that deep breath. And so I'm lifting the rib on that left side in an attempt just to get air in.
But over time, that back just really gets tired and annoyed and will start flaring up.
Yes, it does, all the time.
Let's look at that on the, and you can see as she's walking the whole time, she's in that extension pattern. So she's walking forward with her back muscles, not her hamstrings and her calf.
Right, so this is what I was saying earlier, is that when I'm walking, I feel as if my weight is back in my heels and that I'm kind of leading with my chest and with my hips. And so we're seeing that in the gait cycle right now.
Let's look at side angle now, gait analysis for breathing, how we can improve her efficiency and her energy levels with her breath. So first things, quite a lot of extension pattern. These muscles here are back bending, and these are long, and this is the area after long walks the muscles complain, and you can see why they're constantly on here, which means there's a tightening and a flattening of this area here. So the breath expansion is tricky here, which means then the shoulders have to be pulled back a bit to try and get some breath into here, which then can create a bit of tension through the neck and the top of the shoulders, which I think she also complains.
Right, okay, so this is an important point too. So a normal thoracic spine should curve posteriorly. We call that a kyphosis, and you want to see the shoulder blades, those scapulae, kind of resting on the thoracic cage. But instead what you see on me is this incredible flattening of the thoracic curve, right? So there's no posterior curve, and then you see consequently there's a winging of the scaps away from the thoracic cage. And so yes, it's compounding all that compression into the lumbar spine, but as Verity just mentioned, that's also going to contribute to neck and shoulder pain. So I usually experience that as a sort of nervy sensation around my C7-T1, so right in that space where the cervical spine meets the thoracic spine. And definitely a few times per year, I'll wake up and I can't really turn my head to the right. So there's definitely something happening there as well. That flattening of the thoracic curve is definitely not helping me.
From hip stability that we looked at before. So on the right, she's definitely got a bit more stability. It's supporting her. And then this point at the end where she comes to heel strike on the left, there's a real drop here, where she loses that kind of stability. And then she goes really forward on the left, and you can see then the left, there's a lot more of a extension pattern. So less support through the left leg, the left hamstring, left pelvic stability. So that's why the left is tighter. When she goes onto a left, she really drops that right hip. Again, that's left pelvic work. The plantar flexor muscles, which push the foot down and help propel her forward, she's actually using her back to do them, push her forward, because she's so strong there instead of her legs. So if we can get her to sense her feet, and particularly her left hamstring, her left hip and her left abs, if we look at it from this side, you can really see the rotation. So she really likes rotating here, but then there's less rotation from the right. So the left hip doesn't like being stable here, going right back, which doesn't allow her right leg to really swing forward, which lowers the efficiency of the gait. And then this point here where she goes forward, see that contraction, and the rib flare is pushing her forward, which means the breath is really compromised. So what I would really go after with her is left hip stability, left hamstring, left plantar flexor muscles, left heel, left abs to begin with, and see where we get from there.
Right, so imagine this is my foot, and this is the plantar surface of my foot. This is the part that makes contact with the ground. And so these plantar muscles of the foot, these plantar flexors, are what allow the foot to dome, to create that nice arch, and which activate to propel you off of your foot, to push you forward through space. So Verity is saying that those aren't really activating, and instead I'm kind of leading with my hips and using my overactivated back to move the forward through space. And so in a sense, I'm almost pulling myself forward through space as opposed to actually pushing myself forward through space. And she's saying part of that is because I'm not firing up those plantar flexor muscles, the calf, especially on the left leg, and the hamstrings, especially on the left leg, that sort of posterior chain of the leg that drives the body forward.
In terms of the rotation, you can really see it on the sideways. So as she brings her left pelvis forward, can you see how much rotation she gets compared to then her right? And the left, she then rotates, and then her right, she doesn't quite as much. Left, right. Can you see that? So that means in this rotation, her sacroiliac joint is always slightly gapping which it doesn't like. It doesn't feel, it's unstable there. It wants to open and close, but it's opening a lot and never quite closing its name. And that is down to left leg stability, hamstring, adductor, iliococcygeus, pelvic floor stuff as well, right the way through the foot.
Right, so let's look at our pelvis again. So again, here's the SI joint where the ilium joins the sacrum, right? And so she's saying that this left side is really gapping open, and then never really closing back down. And first of all, this is a gross exaggeration. Your pelvis does not move this much. Your SI joint does not move nearly that much. We'd be in big trouble if that was the case. But this constant gapping of that SI joint is causing this area to get really inflamed. It can really irritate all these nerve structures. It can really start to create some laxity in all of these sacral ligaments over time and compromise the integrity of those ligaments. And again, we're really sacrificing stability and causing pain long term.
Let's look at feet. One of the habits that comes with this patterning of breath, of rib flare and extension pattern is to walk with the hip flexors. So she's pulling herself forward with the hip flex in the back. So if you look at her push off with her feet, she's not really using her feet to push forward. So her plantar flexors, the muscles that push her toes down, to really stabilize the stability through the body so that she can breathe better, have more energy, and move and go for much longer hikes without any pain.
Okay, so you guys heard Verity many times throughout this analysis, throughout this video, saying to me, suggesting that I need to work on feeling, connecting to and strengthening those left plantar flexors, that left calf, those left hamstrings, the left adductors, which is that inner thigh, that middle of the thigh, the left pelvic floor, and the left abs, right? Trying to get that left diaphragm, that left side of the diaphragm back into a more optimal position so that I can actually take that nice, deep, descending breath. So I think I'll probably do a few private sessions with Verity and take her suggestions and work with these sort of corrective exercises for a while in order to try to correct some of these imbalances. And I'll come back to you guys with my progress so that you can see my results in real time. Now, Verity in this quick analysis was only addressing the physical connections and the connections to my breath. But obviously, when we get stuck in specific patterns like this that are causing us pain and dysfunction, that is such a huge load on the nervous system, and it can really cause a lot of mental and emotional issues as well. So this type of patterning can really wear us down after a while and even weaken our resilience over time. So we are going to focus more on these psychophysiological and psycho-emotional aspects of breathing in video number 5 of this series. So make sure you come back to check it out. And then in sharing my symptoms with you today, I really only focused on the musculoskeletal issues, but many of you know that a lot of my long-standing health issues are really gut-oriented. So I want to pull up some images of the spinal nerves really quickly, just so I can really drive home this connection. I want to focus on the sympathetic ganglia right now, since most of the compression we saw in my posture and in my gait was really occurring in the thoracic and lumbar areas, which is where the sympathetic part of our autonomic nervous system is housed. Okay, so let's assume that the average person's scapula, their shoulder blade, lives in that area of T2 to T7. And then we also saw compression even further down the rib cage. So let's extend our view down to maybe T9. Remembering that this T8, T9 is an area of maximal rotation through the spine, which you should be getting a bit of with each step. So as you ambulate, you should be getting some rotation through that mid-thoracic spine. But as we saw in my gait analysis, I'm not getting that at all when I'm walking. I'm very rigid and constricted in that area. So looking at the diagram then, we see this area of, let's say, T2 to T5 is in charge of innervating your heart, your larynx, your trachea, your bronchi, your esophagus. And it's really interesting because there are certain times of the month where I'm much more prone to choking on my food. And if I were to say swallow a capsule, like a vitamin or something like that, I can actually feel it slowly moving down my T-spine. It's a horrible feeling. It feels like this capsule is actually embedded in my back. And so I see this as a direct interplay between what's happening with my hormones monthly and what's happening in the actual tissue and in my holding patterns. And then from T5 basically down to T12, you see these nerve roots come together to form your celiac ganglion. Colloquially, this is the thing that we refer to as the solar plexus. And this branches off to form your superior mesenteric ganglion as well. And now look at what this innervates. Basically, your entire GI tract. So we've got the stomach, we've got abdominal blood vessels, your liver and bile duct, your pancreas, your adrenal glands, your small intestines, and your large intestine. I mean, I have issues in all of those organs. And then we were also saying that there is so much compression through my lumbar spine. So on this picture, we're really only seeing the T12-L2 innervations, but look at how they form that inferior mesenteric ganglion, which goes on to innervate the kidneys, the bladder, the reproductive organs, and even the external genitalia. So these postural issues are critical even for things like sexual health, libido, arousal, and fertility. I hope you enjoyed this demonstration today and that it was enlightening for you. Please leave me some comments and let me know your biggest takeaway. If you're interested in going deeper with this work and maybe even getting a little personalized attention, please consider joining me and Verity this Sunday, January 21st for a very special live workshop called The Missing Link, Gait and Breath. Even if you can't attend live, there will be a recording made available for 7 days. It's going to be an amazing workshop. Try to come through if you can. The link to sign up is in the video description. I want to leave you with this idea that we as Homo sapiens all have to maintain and manage this physical architecture that we've been given if we want to function optimally and be pain-free. So my questions for you are, how are you managing your structure? How are you managing your physiology? How are you managing these forces that are being transmitted through your body every single day? Where are you experiencing symptoms? And how can you make improvements? Because I promise you that you can improve. Your body does nothing by accident. If you are experiencing pain, there is definitely a reason and there is also a solution. Guys, I hope you'll come back next week and join me for video number 4 in the series where I'll be sharing a very special myofascial stretch just for your diaphragm. I think you're really going to love it. Please like and subscribe, please share with your friends, and I'll see you next week.